Now, we are going to demonstrate Rulin and Moore's theory in practice by examining its application within a semi-fictional case study. RS is a 63-year-old male who has been diagnosed with incurable pancreatic cancer and has been living in hospice under palliative care. After 2 weeks, he has become nonverbal, but staff is able to identify his needs as he is still able to nod his head yes or no when asked simple questions. His treatment team hear him moaning one day and approach to assess whether or not he is in pain. RS nods his head yes to confirm he is in pain, pointing at his abdomen, and his nurse offers him Dilaudid 2 milligrams by mouth, which he can receive as needed every 4 hours. They also provide RS a heating pad, which they know has been effective in the past to manage his abdominal pain. The pain medication is deemed effective as RS's moans subside and he's able to fall asleep. However, he suddenly wakes up and vomits. The nurse suspects that the Dilaudid has made him nauseous. After giving RS a full bed bath and change of clothes, the nurse wishes to treat the nausea and vomiting. PRN Zofran has already been ordered for nausea and vomiting, but the nurse does not believe RS will be able to tolerate PO medication, so she calls the attending doctor for additional orders. The doctor modifies the Zofran order to allow for intramuscular administration if PO administration is not tolerated. The nurse administers the Zofran IM and also offers RS Gatorade to drink to help replenish electrolytes lost during emesis. As time goes on, RS becomes less alert and has several episodes of urinary incontinence. The nurse obtains an order to apply a Foley catheter and educates RS on its necessity. RS is still able to nod his head no and refuses the Foley. The nurse offers application of a non-invasive condom catheter and RS accepts. The nurse ensures the condom catheter remains intact and that any leaking that results in soiling of bedding or clothing has been addressed. One day, the nurse enters RS's room to find him weeping. The nurse stays by his side holding his hand in an attempt to comfort him. The nurse asks RS if prayer would help him at this moment, and after RS agrees, the nurse begins to pray at his bedside. Later, when noticing him smiling after hearing a certain song playing on the television, the nurse asks RS if he would like to listen to more music by the same artist. RS agrees, and the nurse finds a YouTube video of one of the artist's concerts, playing it for RS on his phone. Finally, the nurse facilitates regular visits with RS's family members, allowing for privacy if requested, but also providing the family with updates on his condition. The nurse answers the family's questions regarding what steps to take moving forward, including pointing them towards resources regarding interring the patient's body after passing. The nurse ensures that such conversations are held without the patient present to avoid alarming the patient or causing him any increased anxiety. The nurse also recognizes that despite their facility's rules regarding visiting hours, the rules can be circumvented in certain specific situations, such as family who have arrived from out of town and were unable to visit at an earlier time. And that concludes our presentation on Rulin and Moore's peaceful end-of-life theory. On behalf of Sasha Brown, Christina Judson, and myself, Jonas Sevilla, I would like to thank you for your time. Good night.